Good morning, afternoon, evening, whenever you're watching this.
Welcome back to the Dr. Joe Show. Welcome back to the Dr. Joe Show. I'm Dr. Joe. Got Dan with me, my co-host. Thank you for joining us this evening. Today, I wanted to talk about vitamin toxicities. Dan, what have you heard about vitamin toxicities?
Nothing, except from you.
Except from me, huh?
I heard you can never have enough vitamins. Vitamins are $1 billion industry. They're somewhat unregulated in the sense that they do not have to go through FDA approval. So it's off the shelf and anything goes. I mean, they do have to follow good manufacturing practice, and they try to standardize the dose, but you don't really know what you're getting necessarily. And
you don't always know what you're getting, particularly with CoQ10, which, folks, we're going to be talking to one of the world experts, or two of the world experts on CoQ10.
Can't wait.
That's going to be in a couple days, and it's not going to be this really crisp format like we have here with Daniel, our videographer, but it's going to be a Zoom meeting. But stay tuned for that. I'm really excited.
Yeah.
But we're not going to talk about CoQ10 because you can't really overdose on that. I'm interested in the common things people overdose on, and it might get overlooked by clinicians. Not because clinicians are not capable of thinking about it or looking for it. It's because we don't usually get a lot of training on it. So
you train yourself.
Yeah, I mean, somewhat. I mean, I got to see some overdoses of some of these when I was in training, but yeah, I did have to do a little bit of my own directed learning. So the vitamins that we're going to talk about today are vitamins A, vitamins D, vitamins E, vitamin C, and B6, also known as pyridoxine. Okay. So vitamin A, anything you think of when you think of vitamin A?
Vision, I think.
Vision, yeah, retinol. So vitamin A is also known as retinol, and its precursor molecule is called beta carotene. And it goes through all these series of changes so that it can turn into retinol. Orange carrots, that orange color is the beta carotene, but not everything orange is beta carotene, right? Your gut wall is the one that turns the beta carotene that starts to convert it into retinol. But vitamin A is actually one of the more dangerous vitamins to overdose on, and I think most people know not to overdose on it. I haven't seen a lot of overdoses on it because when people overdose on it, they get pretty sick and they end up in the hospital. The biggest sources of vitamin A, the most common sources of vitamin A, like if you're going to get a very large amount of it, are going to be large animal livers. Like polar bear liver is number one. Huge.
When's the last time you had some polar bear liver?
Well, I mean, yeah. Again, I mean, but now Alaskan providers might find it more relevant. People just in Canada and that general vicinity. So, vitamin A in excess will actually. I actually took some notes on it. And there's some things I learned that I didn't know before. So most cases are due to inappropriate use of supplements. Okay, because people take supplements and they think it's a good idea.
You go by the fistful sometimes.
Yeah, sometimes. Well, some of the vitamins you can do that in theory, but you got to be really careful with that. But the other cases are due to people eating animal livers. Or certain aquatic animals. So beef liver is the other big liver source of excess vitamin A. But in subtle, mild overdose that doesn't really manifest as a lot of symptoms, people that have just a little bit too much vitamin A, it'll actually cause osteoporosis in people over time.
Really?
Yeah. So excess vitamin A, it inhibits osteoblasts. Now, osteoblasts, the B for building, those are the cells in your body that build bone. And there's osteoblasts actually in your arteries. And they're not supposed to build bone. So that's why vitamin K is important. Again, we're not talking about K overdose because you don't really overdose on K. But so, yeah, osteoporosis and then liver damage because it actually stimulates excess build of, I think, collagen. And so then it causes blockages.
From vitamin A.
Yeah. So
osteoporosis.
Oh yes, I remember
knows.
now. It inhibits collagenase. There we go. Because you have enzymes that build and enzymes that break, and so it kind of tips the scales, and it causes excess collagen buildup in the structure of your liver, and so then it can cause really bad liver damage.
Wow. And that's in very high doses, or like mega doses.
Yeah,
or?
I mean we're talking mega doses, like super high doses. But there is a diagnosis, IIH, idiopathic intracranial hypertension. So kind of the similar idea as with the liver. Too much vitamin A can lead to IIH, and it's just because those channels in your brain where the CSF has to be able to move through freely, those channels get tight, and then the pressure in the brain goes up. So it's that buildup of connective tissue that eventually will block the CSF from getting out, and that's
Wow.
really bad. So vitamin A, folks, do not take too much vitamin A. You got to review the daily value that's recommended, and I think there's a table, if I'm not mistaken. You know, and folks, this is Goldfrank's toxicology. This is this is one of the major toxicology manuals of planet Earth. Anyway, so. For males, the vitamin A daily limit, let's just say for somebody 19 to 50, is anywhere from, so it's 900 micrograms or 3,000 IUs. But if you're eating a healthy diet, you don't need to take extra vitamin A because you just.
But most people don't have the healthy diet.
Most people don't have the healthy diet, and that's where the supplements come in.
Yeah.
So vitamin A, folks. So the next one, vitamin D. Now, vitamin D has been, I think, at the forefront of people's thoughts the last 3 years, right?
Yeah.
So vitamin D is found again in mostly animal products, and you get it from dairy products primarily. You can get it from fish. You could get it from cod and krill and some other stuff. But what does vitamin D do? I mean, vitamin D is involved in so many processes in your body. And I'll be honest with you, I actually haven't seen a clinically significant vitamin D overdose on the inpatient side. I mean, I think we saw it on one patient incidentally, but that we came to the conclusion that it didn't have any impact on what was going on. But
Fat soluble, right?
fat soluble vitamin, yeah.
And
So
vitamin A was.
vitamin A is a fat soluble vitamin, yeah. So. We'll backtrack, okay? There's 4 major fat-soluble vitamins, vitamins A, D, E, and K. Good question. Mm-hmm. So vitamin D, vitamin D has to get activated. There's ergocalciferol, and there's cholecalciferol, and calcitriol. Calcitriol is the fully active form. And so for the providers out there who take care of patients with severe kidney disease, with end-stage kidney disease, I'm sure you're injecting your patients with calcitriol, active vitamin D, because the kidneys don't do their job anymore. I think it's alpha-1 reductase, right? It's like 125 vitamin D, I think. Yeah. So that's important that you can activate your vitamin D and utilize it because it supports your immune system. It supports your bones. It supports healthy heart function, healthy microbiome function, increased C. diff infections, Clostridium difficile infections, in vitamin D deficient people.
Nasty condition.
Yeah. So what are the symptoms of high vitamin D and why? Well, the toxicity of vitamin D is basically all based on calcium. You have too much vitamin D, you absorb more calcium out of the gut, calcium goes through the roof, you get all the symptoms of hypercalcemia. That can be heart rhythm issues, changes on the EKG that are very specific, irritability, somnolence, diarrhea or constipation, abdominal cramping, pain. You can just get random pain in your bones and your joints. So it's just a whole bunch of symptoms. So, and the tricky thing is that those symptoms can be present with a lot of other things. I mean, those are fairly nonspecific symptoms. Like, so that's why you got to take a history. You have to ask people, what supplements are you taking?
Those are like symptoms for basically any drug side effect.
Yeah, like abdominal pain. I mean, abdominal pain is the biggest differential of any complaint. You know, in
But
humans.
how? I mean, you said you'd never really seen any vitamin D.
I've seen really high vitamin D levels.
Yeah.
But sorry, didn't drink enough water. I was in clinic all day. I've seen really high vitamin D levels, but it didn't amount to anything clinical. Like, I've had patients with okay vitamin D numbers, and then they were on vitamin D supplements, and then they start losing weight, and then their vitamin D goes through the roof. So why is that? Because the vitamin D is complexed in their fat tissue, and so then the patient loses weight, and all that vitamin D gets released into the bloodstream.
Because the fat's breaking down.
Because the fat's breaking down. But that also means that whatever concentration of vitamin A and E and K that was in their body, that's also getting released all at the same time.
You think we can take some altitude on this and maybe, because I don't think it's ever been discussed on a show like this, or any show for that matter, what vitamins are even supposed to do, like their role in just reactions in the body. They're cofactors, right?
Yeah, I mean, glutathione, you could say, is the secret power of our body. It's this almost forgotten molecule that we have to have in our cells, because glutathione scavenges oxidative damage. Because the way aging is, the way inflammation is, the way any insult on our body is, it's free radicals, and it's some sort of attack. And glutathione scavenges free radicals. So you have to be able to have adequate glutathione stores in your body to keep things going.
And how do you get this?
Well, first of all, glutathione has sulfur groups in it. So you have to have amino acids that have the sulfur groups on it. So that's like cysteine, yeah. Methionine. I think serine is another one.
Serine.
Are those the three? Are there only 3 thiols in the amino acids? I think there might be a 4th one. I can't remember. But anyway, those are essential amino acids. What does that mean? It means you got to get them from the environment, you got to get them from what you take into your body. So amino acids like aspartic acid and glutamine and glycine, that's stuff that our body makes. Those are non-essential amino acids, but you can supplement with some of those, and interestingly, good things happen for some people when they supplement with those. And so that's another interesting discussion. But
so glutathione is
it's the antioxidant reserve that resides in all of our active cells.
So it's not a vitamin.
No, I mean, it is a vitamin.
It is.
You can take glutathione under your tongue, or you can take it by mouth. But what I didn't research before before our talk here is what happens to glutathione if you ingest it. Like, does it just go freely, or do you break it down and then make it again in your cells? I think you break it down.
But like the role of vitamins or glutathione is to be to be scavengers for free radicals, or are they to be cofactors?
You support your body's cellular processes. I mean, it all works together. Like your immune system doesn't work well if you don't have vitamin D. You get more bone mineral disease if you don't have vitamin D. But vitamin D isn't the singular thing you need to prevent osteoporosis, because you have to have weight-bearing exercises, and you have to have collagen. You got to have all the raw materials there. It's not just about calcium and vitamin D. You got to have everything.
Muscle.
Yeah, so you have to have muscle anchored to the bone, because muscles and bones need each other. So they work together to keep the body going. And we're not supposed to be thinking about vitamins if we're eating what we are supposed to eat.
Like what our ancestors did.
What our ancestors ate. I mean, the most successful people in history who like made a mark on the world, they obsessed about the food they ate.
So did food get vitamins removed or nutrients removed out of it due to westernization? Like, is that essentially what's happened in the last century or two?
Yeah, and different types of nutrients get removed in different parts of the food industry. Like pesticides, pesticides are planar molecules, and it's like a plane of electrons, and you're just ripping cations out of the soil. So all the trace minerals, they just get torn out of the soil, and I don't know, they get pissed away somewhere.
Yeah.
But the fat soluble vitamins, that's tough because our milk products are heavily processed and probably lose a lot of their vitamins. That's why does milk have to get fortified? Well, why do we drink milk anyway, right? Oops. But there's all these folks that won't eat fish. Like, oh, I don't like sardines. Sardines are complete nutrition.
Complete, even in the can, like the way
Complete. Well, you get complete nutrition if you eat a sardine. You get all the vitamins and minerals that you need.
So you can just live off of sardines your whole life.
In theory. In theory. Like, I mean, the Inuit, they live off of the limited stuff they have there. And it's because the animals up there in the Arctic areas, those animals are eating from the cleanest parts of the ocean.
When the last pod the new research they're looking at is shark sterols.
Yeah, shark aminosterols, right?
Aminosterol,
yeah, shark mammalian aminosterols, So yeah, vitamin D is really important. So yeah, I've seen really high vitamin D levels, but I haven't seen it cause hypercalcemia. So I do think it's sort of it would have to be really high doses for prolonged periods of time, or just a massive overdose, and doesn't pan out that much. So vitamin D, folks, if you are supplementing with vitamin D, please have your doctor check your levels so you don't get too much.
Most people are low, and even
most
me,
people are low.
I take vitamin D. I'm still on the lower range, and I try to get morning sun. Like, the theory is you should get enough vitamin D from the sun, no?
Yeah, the sun can activate your vitamin D. It can reactivate some of your vitamin D. But
how does it work in a place?
Some of your vitamin D will go into an inactive state, and then you just kind of lose it. So you still have to get some from your food. Yeah. But your question was,
like, in a place like in a sunny place like Arizona or California, how are people vitamin D deficient?
Well, because we cover up. We wear long sleeves. And we don't go outside enough. One of my sayings to my patients: looking out the window doesn't count. It's like, oh, it's hot outside. Yeah. Oh, but yeah, it's really sunny, and
they say the morning sunlight is best.
Morning sunlight is gentle, and it's okay to get some of that on your skin. Yeah. So, but when the sun's really high, and especially the Earth's geomagnetic field is weakening, and so people are getting sunburned easier now. The easier sunburns in part is due to pollution, but it is also due in part to our weakening magnetic field and
this is an epic
cataclysm
pod.
incoming type stuff. Yeah.
So we got vitamin A, vitamin D,
and we got vitamin E. So vitamin E overdose. So vitamin E is interesting. It's a tocopherol, and it works with other vitamins. So it works with vitamin C. I think it regenerates vitamin C. Or no, vitamin C regenerates vitamin E.
So you take vitamin E with vitamin.
Yeah, vitamin E comes with usually the other fat soluble vitamins. So if you take like krill oil or cod liver oil or whatever, the fat soluble vitamins are going to be all in there. So where was that thing I found? Yes. So vitamin E will actually regenerate vitamin A, and then vitamin C regenerates vitamin E. There we go. And then
What do you mean by regenerate?
Once they get used, once they get used, then they're in this inactive state, like the molecule is, and so then you have to have another molecule that works with it.
Oh, I see.
So and folks, I will post this right here. Actually, I just did. Okay. So well, Daniel just did, but so ascorbic acid, vitamin C, works with vitamin A, and vitamin A works. Sorry, I'll say it again. Vitamin C works with vitamin E, and vitamin E works with vitamin A. But vitamin E also works with CoQ10. It actually goes from ubiquinol to ubiquinone. So CoQ10 actually helps to prepare vitamin E to work with vitamin A. So these all work together. CoQ10, vitamin C, vitamin A, and vitamin E, they work together. And vitamin C, I guess that kind of leads into our next one. So back to vitamin E toxicity, though, before I forget. Vitamin E toxicity, in theory, because it can thin the blood, there's a theoretical concern that it can lead to bleeding, but it's not a clinically significant risk. But we still recommend people don't take it before they do surgeries. But
And you can take it with baby aspirin. This is not medical advice, by the way.
can you? I mean, yeah, I guess you could, but I just most people, I just tell them just don't take vitamin E. I just don't.
No, just skip it.
I would skip it. I mean,
Which of these that you've mentioned?
I would defer to a naturopath on when to use it. I'll just
Okay.
say that.
So you use PRN.
I would go based on what a naturopath says, because they get different nutritional training than we do, and I'm sure there's a good use for it, but most people don't use it properly.
Are you on the school of thought that we don't actually need supplemental vitamins? We just should be getting it all from our
Well,
food?
ideally we shouldn't, but the reality of our world is we have to supplement a little bit. If you can live the lifestyle where you take 100% control of what you put in your body, in the ideal world, like, yeah, I'm slaughtering my own animals and I'm making my own cheese, and I got and I happen to have an olive tree grove. Like, wouldn't that be nice? And I make my own bread and it's sourdough, and yeah, wouldn't. So if you could have the stars align, but not the case. So
Okay.
you do need to supplement a little bit. But yeah, vitamin E also interferes with your thyroid numbers. So sometimes there are patients who come in and they don't have any symptoms, and they might be on vitamin E, and you check their thyroid labs and there's just mildly off, but they have no symptoms, and vitamin E can do that. So, but vitamin E is not as interesting.
Mildly off, you mean hypo or hyper? Or either?
It can do either.
I see. You know, another one that messes with the thyroid I'm learning about from our studies is this calcitonin. This is like a lab value I've never really considered. And on every GLP-1 study we have, they're looking at calcitonin because it will elevate, and something to do with thyroid cancer, thyroid C cells, CT cells. Can't remember the mechanism, but increase in calcitonin.
Wait, so like semaglutide causes calcitonin to go up?
That's a theory. Like in animals, it does.
I
In
wonder,
rats.
can we check that routinely in patients?
We are in our studies.
Oh,
That's
cool.
that's what we're doing. Like every time they come in, we draw a bunch of labs.
Well, that's cool.
Yeah.
Yeah, I know procalcitonin is a marker for pneumonia. It's like a really, really powerful marker. Like if it's negative, there's pretty much no pneumonia. This is more of a hospitalist thing,
Yeah.
but
Interesting when you said vitamin E and thyroid. It brought me back to calcitonin because somehow calcium is involved in that.
yeah, because parathyroid hormone and calcitonin kind of, they work in balance. Parathyroid hormone takes calcium from your bones, and calcitonin, it tones your bones, so it throws calcium into your bones. It causes more deposition of calcium, but it does other stuff too. But yeah, that's why they'll spray calcitonin up patients' noses when they get hypercalcemic. It's an effort to bring the calcium levels down.
By putting it in the bone.
Yeah.
Taking it out of the blood.
Yeah,
putting
like
it
you're
in-
shunting it in the bone. It's the same idea as hyperkalemia, because when you treat patients with malignantly high potassium, it's going to stop their heart. you want to hit them with drugs that stabilize the potassium and bring the potassium down. So you give them Lasix to pee it out. You give them, well, the first thing you're supposed to give is calcium gluconate because you want to protect the heart first. Always calcium gluconate first. And then you can do your other stuff, your Lasix, your insulin, and your albuterol and dextrose and stuff. And
calcium comes up a lot.
And then your Kxalate, because Kxalate doesn't work that fast.
Calcium comes up a lot. Is this on your list of like vitamins? Calcium?
Well, calcium gets limited absorption, but that's why vitamin D and calcium have a very intimate relationship. So, and having adequate calcium intake is important, soluble calcium, because calcium scavenges oxalate out of your food. So you don't need a ton of calcium, but like you need a decent amount.
Chris went to get that. Chris is the producer, one of the producers of this show. He sometimes joins us on the Zooms. He went to get that. I think it's angiogram. Where
he had an angiogram.
Is that the one where they look at your like?
Yeah, they put contrast and they look at the arteries.
He had one last year, and they told him not to take calcium anymore. He had calcium deposits. So is that something like...
He needs K2. He needs to take vitamin K2. So if he has calcium in his arteries, that's because osteoblasts got turned on because he doesn't have enough vitamin K2.
Yeah, he had some buildup, and they said don't take the...
Yeah, so, I think there were some animal studies about high-dose vitamin C and folic acid, I think, and how it decalcifies the arteries over time. But that was an old animal study. But
K2, so K2.
But it's really hard to decalcify your arteries once they're calcified. But it can be reversed in theory. It's just, again, there aren't really big studies on it.
Gotcha.
But K2 is something that, as long as the person doesn't have, as long as they're not on Coumadin, right? You don't want to take it if you're on certain blood thinners, right? But yeah, okay. but otherwise, healthy people without meds, they should be able to tolerate K2 and prevent calcification of arteries. But yeah, we touched on vitamin C a little bit. So vitamin C toxicity is pretty straightforward, actually. It's just diarrhea. Diarrhea is the main clinical thing that happens. So if you go to the store and you buy a bunch of vitamin C and you're like, oh, I'm getting over a cold, or I got exposed to somebody, so I'm going to take a whole bunch of vitamin C. Well, let's say I take 3 grams of vitamin C. Okay, I'm gonna absorb no more than 250 milligrams every 3 hours in my gut, and then the rest of it is going to sit around in my gut and pull water into itself and fly out my rear end. Okay, that's called an osmotic diarrhea. Okay, so excess vitamin C causes an osmotic diarrhea.
Osmotic because it pulls water in.
Because it pulls water
and
in
it forces water. Okay,
and then it just goes out. It's because it's like, well, we got the water and we're keeping it here. That's
similar to like mag
citrate. Yeah. Most of those laxatives, they work via
draw water in.
Yeah, via an osmotic. But there's excuse me, I put omega-3s in here and it's making me like that. But there's and this is a side note, psyllium husk. Okay, that's a natural product, right? Yes. Okay, so I'm not bashing anybody. Psyllium husk, if you do not hydrate well with psyllium husk, if you're taking that every day, it'll constipate you. Psyllium husk is deceivingly dangerous for people. So a little bit is great. So then people think, oh, more is better, and then it turns their stool into near cement, and then they're digitally disimpacting themselves with a latex glove. So you don't want to take too much psyllium husk.
Gotcha.
So, but vitamin C, yeah, osmotic diarrhea. Now there's a theoretical concern that that vitamin C can cause kidney stones. Okay. Mm-hmm. Now, I think we talked about this. Do you remember, Dan, which kidney stone is the most common?
No.
80% of kidney stones are calcium oxalate.
Okay.
Okay, give or take a few percentage points. So, so calcium oxalate, when it and again, this is why there should be a little bit of soluble calcium when you're preparing high oxalate foods, because you're stonifying the oxalate in your gut before it gets absorbed in a soluble state.
What would be like a high oxalate food?
The common ones that people think of are like spinach and tomatoes.
Okay.
But quinoa is high oxalate.
Yes.
Nuts.
Saponins.
The saponin type things. A lot of the seeds. So you got to do some research. There's tons of references, and the major university programs of our country, they have decent references, and they're all kind of similar, right?
Are you pro or con quinoa or neutral?
I mean, I think a little bit is okay. I think a little bit of quinoa is okay, but I think it has almost complete amino acid nutrition. It's definitely a healthier grain to eat than rice.
I couldn't tolerate it.
Why?
GI issues.
Oh,
really bad. I would get bloated and very gassy on quinoa.
Oh, yeah. It could have been the way you prepared it.
Maybe.
For example, if you don't prepare certain grains the right way, then they're not going to go down very well. Like millet and amaranth. Millet is really finicky. You actually have to sear millet and make it smell kind of smoky, and then add the water, and that makes them puff out, and then you got really good millet. But if you just throw water in it, it doesn't pop out.
Gotcha.
But yeah, so vitamin C, it goes through a series of so we talked about, folks, that graphic that we popped up here recently. Vitamin C, among the many things that it does, preventing scurvy, right?
First clinical trial ever.
Right.
James Lind.
Yeah. Limes. Just eat some limes.
Yeah.
But as it regenerates vitamin E, it gets turned into another molecule, and I think that molecule it says a sorbal radical. So it says it's a radical, but it's dihydroascorbic acid. There we go. Now, dihydroascorbic acid gets turned back into ascorbic acid by glutathione. So if you have adequate glutathione stores and you're taking a good amount of vitamin C in, and your glutathione stores are solid, then you can probably be rest assured, in theory, that the vitamin C will not give you kidney stones. But if you're glutathione deficient and you take too much vitamin C in, then you're not going to be able to. Here, I'll just show y'all right here. Boop. You won't be able to get your vitamin C back. And then your vitamin C will go down into a series of other processes where it gets turned into oxalate. And then your body needs to do something with it. And the first thing oxalate is going to do is it's going to grab the nearest calcium, and then it's going to chill out in the kidneys. But oxalate crystallizes with itself. Well, calcium oxalate does, because it's a rock. Once calcium oxalate forms, it's like that.
So that's the kidney stone.
Like that solubility factor is like.
So that's the 80% of the kidney stones.
Yeah. So
vitamin D will enhance that or further catalyze that.
In the presence of excessive oxalate.
Yeah.
So, but pure hypercalcemia without oxalate is hypercalcemia, and that's not good either. Right? So, see, there's a balance, and that's why there's established daily values for all the vitamins. But vitamin C is heavily debated by the naturopathic community mainly, and the functional medicine doctors, because you hear stories of people going to these infusion places, and they get injected with tens of thousands of units, milligrams of vitamin C.
With people when they have cancer, also.
They go to places and they get this done, and they walk away, and they're fine. So. I don't know what to say about that. I don't have an opinion one way or the other. Because I don't know.
What's vitamin C's relationship with the glucose and that whole
with glucose
breakdown and insulin?
I think there's a connection to the pentose phosphate pathway, actually, but it's sort of distant because the relationship between vitamin C and the pentose phosphate pathway is through glutathione and NADP and NADH.
Those came up before, no?
So, but it just goes to show you that it's this beautiful intertwining of all these molecules. You need all of them, And let's see. Oh, B6. Oh, B6. I love B6. Well, no, I don't like B6. So, but it's so interesting.
Well, B6, the biotin, right?
No, biotin, that's another B. It's not B6.
Okay.
Pyridoxine is B6.
Oh, okay.
B6 is one of the most problematic B vitamins, okay? Because most people think, I can get as much B vitamin as I want. I can take this and this and this and this, right? You can't overdose on folate, for example.
Mm-hmm.
You probably can't overdose on B12, even though you check people's levels and it's through the roof.
I just took an injection yesterday.
Yeah. But B6, if you get too much B6, your neurons will start just losing their protein sheath. They'll just start getting destroyed. And people can get symptoms that look like strokes.
Why do they take B6 to begin with?
Well, because they think it's good for them. They think, oh,
like
it's,
energy or
like, oh, it's good for me.
but for what? Like, what do they think? Like, what's the misconception?
It's literally because I thought it was good for me. I am quoting an untold number of patients. I'm
just
not kidding.
because it's B, maybe they got it mixed up with B12 or
yeah. I mean, B12 deficiency, for example, you see that like the classic B12 deficiency presentation would be a patient with a stocking distribution neuropathy, and it can be unilateral. It can just be one foot, but the classic is both feet. And you check their B12 level, and it's in the toilet.
Or like tingling feet, or
yeah, it's like a tingling, like a burning, pins and needles neuropathy, and it's in a sock kind of distribution. And you check their pulses. Their pulses are nice and strong.
So like your foot falling asleep, or you're talking
it's
like
it's like a feeling that your foot is always waking up from having fallen asleep,
even though you're not sitting
but it
awkwardly.
never fully wakes up. Yeah.
Okay.
And so the quickest thing to do is you check a B12 level, but you also take a diet history. Because what diet do you think is most associated with B12 deficiency? Something
with a high glycemic index?
No, it's more so people that don't want to eat animal products.
Vegans.
Yeah, so this is another reason why vegans are wrong, okay? And to all the vegans out there, I really appreciate you not eating meat because there's just more for me. Okay, but anyway, so you like that one, huh?
That's a short. That's a viral short if I ever heard one. Wow, we struck gold with that one.
Oh, yeah. I guess we'll see, right? But yeah, so but yeah, like so you need B12. But now, okay, you can get complete nutrition from brewer's yeast, and you got to mix it up and just drink it, pure brewer's yeast. That
not beer,
not beer. Like don't make beer out of it. That's
just giving people a reason to drink.
Yeah, like the beer is the waste product of the yeast. The yeast are somewhere else, and then they left the beer, so you're drinking their pee poop. But no, like brewer's yeast has complete nutrition in theory, so that's one way to get it. And fermented foods in general, like fermented foods, fermentation, it releases certain chemicals and micronutrients that we need. But that's again another podcast. This is supposed to be about overdoses, but you see, like
they're all connected, though.
Yeah, it's all connected. It just leads to all these different pathways, which is why it's infinitely interesting.
That's why this show will never end.
Yeah. So okay, yeah. So B6. So the most common symptom with B6 overdose is dizziness, but what's the most common aspartame toxicity complaint?
Headache,
dizziness.
Yeah,
neurological complaints. So you could say headaches and dizziness.
Caffeine also.
And caffeine, because caffeine excess for sure.
Because if someone's drinking a bunch of Diet Cokes and they get dizzy, they're not going to blame the aspartame per se. They're going to blame the caffeine.
Yeah. But I don't know. I mean, on days when I have extra caffeine, I don't feel dizzy.
I get it at times. That's when I know I've had too much. When I start getting dizzy.
I mean, yeah, like if you're not used to having espresso and you go out with friends and you get a drink with 4 shots in it, and you're used to your one little cup in the morning, you're gonna get. Yeah. But yeah, B6 folks. So the classic presentation, I would say, is patient comes in, neurological symptoms, and it may or may not look like a stroke. So what do you think if it looks like a stroke, right? You're going to send them to the hospital.
Yeah.
And then you're going to order a big workup. Well, you're not going to the hospital but it's going to be a big workup. And, oh, yeah, we ruled out a stroke, and we're going to have you see all these. But then nobody checked a B6.
Nobody's going to check that.
Yeah.
That's considered
and then if you check
luxury.
and then if you check a B6 level and it's up, it's like through the roof. You're like, oh, wow. So that's why. And then you got to wait for it to drift down. Like there's no way to treat B6 overdose other than just stop taking it. But but that again, it goes back
Can't
to the
take
basics.
like niacin flush or something like
Niacin. Again, we should review the biochemistry of the relationship of niacin and pyridoxine.
They use the niacin flush.
Niacin's B3.
In the phase 1 healthy volunteer studies, when someone's got a maximum tolerated dose of something, they usually use a niacin flush
To flush it out? Oh, to flush what out?
whatever the IP is. Like,
Really?
Yeah, it's very common.
That's interesting. So you can... I'm going to have to read about that.
Yeah. Maybe it's another
Playing
podcast.
with niacin, yeah, that could be another podcast. But yeah, so so the classic thing that you see is like patient might be taking a lot of supplements. They're usually taking like maybe that vitamin C cocktail every morning, or they're taking a B complex and with a B6. So you do not need much B6 every day. Mm-hmm. And if you ever take it, it should just be in a B complex.
And was that folate again? B6?
No, B6 is pyridoxine.
Okay.
Folate is that B9 or is that B10?
The B complex. Can you just give us a brief? Do you know like the story? Like why? I think I read something they just got lazy naming things.
Yeah, they got lazy. I mean, it's the same thing as the EKG. Like why? So why are the important things on the EKG P, Q, R, S, T? Like why?
QTC.
Because A to O was a bunch of junk. Mm-hmm. And then they got to the PQRST, and that was what was relevant to the heart. So it's just how it was discovered. So
yeah, this is very confusing though.
So the B vitamins, so yeah, they were originally named because they thought that these were these were vital, and we have to get them out of our food. But not all the B vitamins are considered vital. Like a percentage of them are. So thiamine and folate and B12 and a little bit of B6 and stuff. But the B vitamins, the real B vitamins we need, it's all about protein synthesis. It's all about methionine synthase, because methionine synthase is how you start. Methionine synthase is how you make the methionine, and it's all about that methyl group. You have to be able to methylate the precursor so that you
CH4?
can get methionine.
CH4.
Yeah, CH4 is a methane. But you have to get that methyl group, onto the what will become methionine. Because why do you need methionine? Start codon. AUG is your start codon. You start protein synthesis with AUG. Every protein in your body starts with AUG. So if you don't have methionine, you're screwed. You can't make proteins. So
methionine finds the AUG codons.
Yeah. The way protein synthesis works, it's like a freaking miracle.
Yeah,
DNA.
Get the RNA.
RNA. Oh boy,
ribosome.
We're going back to molecular bio now. It's not reverse transcriptase, but yeah, it's just like the protein.
So
synthase.
methionine plays a role in this process.
Is it transcriptase? Yeah, you transcribe it anyway.
Mm-hmm.
But yeah, and so this protein, it like opens up the RNA that you get from DNA, and it goes like and it doesn't make that sound, but it pulls in the amino acids that have been complexed with the nucleotides. I mean, it's an amazing process, but you can't start without methionine, AUG codon. So that's what codes for it. So
gotcha.
So that's a big part of the B vitamins. It's keeping it going,
and
so
you can get that
keep making more.
So if you're lifting, you got to have methionine.
Well, you don't have to have it because you're supposed to be able to make it with your B vitamins. So methionine. That's why
there's no methionine supplement. Like
there is. But the weird thing is, if you take too much methionine, there's a theory that it shortens your lifespan.
Really?
Yeah, so they did animal studies, and too much extra methionine actually led to shorter lifespans.
So too much protein synthesis. You're making something work too much.
Yeah, it's like you're overclocking the cells, and then the telomeres get cut, or I don't know what it is. But
They age faster. They're working more, and so
so that's why well, like what you told me about metformin, you know, so people who lift
muscle,
and then so like people who are lifting and playing with metformin, they don't take metformin on their lifting days because metformin messes with muscle building.
it's a theory.
So metformin for wellness,
Yeah.
right? So yeah, it's
So
very,
that metformin thing is not a theory; it's fact. Like they've done studies on that, but it's a theory as to if I take it on non-lifting days, if it's going to actually do anything.
right.
That's the theory.
Yeah, but metformin it locks your cells into this sort of a state of living longer.
I do both.
That's
I
the
lift
short of it.
and I take metformin. I try not to take metformin every day, but I don't lift every day. I should be lifting like 4 times a week. I'm doing like 2 or 3 right now, but yeah, I do both.
Yeah.
And then non-lifting, lifting days doesn't matter.
Yeah.
I think the testosterone is what men should be. That's a whole nother podcast.
Well, yeah, men need to be optimizing their testosterone.
Yeah, because if your T levels are good, like the other stuff is just icing on the cake, I think.
Yeah, and optimizing your testosterone. Well, you got to read the book Estrogeneration
Oh,
by
my
Anthony J.
gosh.
Oh, we brought it up again.
What do you feel about? Maybe it's a teaser. And do you want to cover anything else on this one before we do teasers, or
Teasers?
are you good with like this topic, or is there anything left that you had?
No, I mean like.
There's clearly need a part 2.
It's kind of funny because Goldfrank. I came to Goldfrank because I was going to do these, and the chapter had exactly all of the things I wanted to talk about. So, I mean,
So you just opened it?
Maybe I should have done toxicology, but
Nicotinic acid.
nicotinic acid.
Nicotine's good for you, no?
So where does that come from? Niacin.
See, niacin.
Yeah,
I'm telling you.
niacin was the other one that they listed here. But clinical manifestations is vasodilatory flushing, which you were talking about.
Yeah,
You take a
niacin flush. Yep.
So, but is it really toxicity if you're using it to detox? That's
You're using it to detox from, and I don't know if they use it for every phase 1, but it's a thing. Niacin flush. It makes your face red and all. You ever done a niacin flush?
no.
You want to do one live on the show?
We could get the lighting. Could get grow lights on us. So
We'll
you get all
turn
the
this place
wavelengths.
into a phase 1 unit. We can do it.
Yeah, or like we could, one of us could eat a ghost pepper, and then the other one will take 3 grams of niacin, and then
I volunteered
we'll just have
Daniel for
cameras on
that
our
one,
face,
yeah.
you know. Folks, don't do that, please.
So cliffhangers, like we got other topics we need to discuss. We've got
Yeah.
well, by the time this is uploaded, that interview will have been done already on the CoQ10.
Yeah, we're backlogged on a few videos. So there's the video from the health coach, which we still have to upload.
Oh yeah, you'll send me that, right?
Yeah, I'll send that to you. I mean, I think hopefully you can get into the link, but
Yeah.
that needed to be edited. So the health coach visit, it needs to be uploaded. Our pod from
It's
last
good
week,
content
and
everywhere.
then there's this one, and then there's the one that we're recording in a couple days.
Yeah, it's good
remotely.
content, and then we'll get Dr. Hazen on for gut dysbiosis.
We gotta get Dr. Hazen on here.
I'll get
We're
her.
gonna-
I'll try to get her on a Zoom next week.
Yeah.
All right. Well, thank you so much. Links to everything, I guess.
Yeah, the description box will have the stuff that I think should be in there. And folks, please comment, like, subscribe, and share. Thank you for tuning in.
Thank you.